So the typical side effects that we may see, and some at the time of, this recording, these are the side effects, but there may be more that we figure out over the next, who knows how many years. But currently, the current side effects, of course, we can have gallbladder problems. You can lose your gallbladder. You can end up with sludge or gallstones. You can end up with nausea, vomiting, dehydration, headaches. There are some people, I actually had one client who had to get off of these medications because it caused an increase in his depression. And so we have seen some of that. I don't know how much of that is in the research, but that is a risk. And sometimes I relate that to inadequate intake. So you're not eating enough, but this person insists that they were eating enough. So I digress. Much better off of the medication. So those are the big ones. There's one that has come out more recently about eye complications. So what they see is you can have, brace yourself, it's a little scary. You can have sudden vision loss overnight. And when I was consulting ChatGPT to figure out why that's happening or what their research is saying about that happening, it seems to be because of blood pressure drops. So people who have diabetes are at higher risk for that, people who have high blood pressure. And some of that can be because they're not eating enough either, or they're not drinking enough. And so you can have dehydration, which drops your blood pressure and all of those things. So that is a potential side effect. It's a very, very small percentage. And it's even controversial on if there's an increased risk of that on these medications compared to the norm, people who are out in the world not on these medications, if there's even a difference there. But we'll see with time. So the biggest ones I think that I've seen in my office are things like nausea. I don't have anybody vomiting. I haven't had anybody, I hope this doesn't jinx me, I haven't had anybody lose their gallbladder or have any gallstones. And we can go into, losing your gallbladder and having gallstones because of this medication is not necessarily the medication either. So that can be, you can see that in gastric bypass. You can see that in extreme weight loss as well, in any form. Food aversions is a big one. So I really compare, if you've ever been pregnant, I really compare a lot of the side effects to what you experience in pregnancy. It's really weird how related they are or how similar they are. So it can be like, okay, I'm hungry, I want to eat, and then, oh, no, I don't want to eat anymore. Or getting full really quickly, or food aversions as well. Of course, nausea, vomiting, fatigue. So these medications, side effects listed on the website that you can have fatigue, headaches. And I can sometimes see some decreased enthusiasm about exercise. And I think that's a decrease in overall energy. You can also have hair loss as well, and that can be for multiple different reasons. Constipation or bowel impaction can also be another one. So we really, in my office, I really stay on top of people's bowels because the last thing I want is for them to be full of poop and then they're having nausea, vomiting because of that, because that is the worst feeling. So constantly asking about bowels, making sure things are moving at least every other day. And there are just different techniques that you can do to make sure that that's happening.